Hello and welcome everybody to this week's edition of the midday download. We appreciate you taking time out of your lunches to listen and have a conversation with us today. Throughout the year, we have been having a lot of dialogue, sharing a lot of the great work that we've been doing here at CAQH. But we thought we'd take a different approach today. So today we're going to spend a little bit of time sharing some of the feedback that we've gotten from you all and from some of the organizations that we've spoken to over the years regarding provider directories, and hopefully get some additional feedback from you all regarding how you're addressing these concerns and approaching the provider data accuracy problem as an industry. A little bit about myself. My name is Scott Everline. I work on the business development team here at CAQH. Over the years, I've had many conversations with health plans and healthcare organizations regarding provider data, from credentialing to ongoing monitoring to verification, and very much so in the directory space as well. So a little bit of light housekeeping before we get started. This session is going to be recorded. Everyone will receive a link to the recording following the webinar. We're going to go ahead and mute everybody's telephone, so you won't be able to speak with us. However, you will be able to type in any questions you have in the questions box on the right-hand side of your screen. All right, so for those of you who aren't familiar with CAQH, we'd like to share a little bit of history about who we are and kind of our approach to the industry, or approach with the industry. CAQH is a nonprofit alliance of health plans and trade associations. So we work with the organizations that you see here on the screen, along with many other organizations, to help define industry challenges when it comes to administrative transactions or exchanges of information. So through that work with member organizations, such as you saw on the previous slide, as well as some of the work that we've had with non-member plans, we've kind of worked through and looked at a lot of this directory and provider data problems. And we had a couple questions we'd like to ask the group, and then we'll go over some of the questions that we've heard over the years as frequently asked questions, and share some feedback and the insight that we've attained through those conversations. So the first question, and this is going to be a poll question, but you can go ahead and type your answers into the question box. So what keeps you up at night about improving the data accuracy of your provider directories? Great, thanks for those of you who provided some responses. So definitely some recurring themes and things that we hear when we're out in the market talking with stakeholders. So a lot of it's providers' participation, right? Their willingness to engage and share that information, and then being timely with the information that they are sharing, making sure that the organizations are meeting government requirements. And unfortunately, as many of you probably know better than I do, not all the government requirements are in line, right? So you have various state requirements. You also are going to have any kind of federal requirements that are applying, and then other components. So we're going to move on to another polling question. Thanks again for your answers. So polling question number 2, and this will be a poll, so you'll be able to go through the multiple choice and provide your answer. How much of a priority is provider directory management or improvement in your organization? So it looks like 63% of the organizations or respondents have said that it's a high priority. We'd like to see that both as an organization that provides solutions, but also, of course, as an industry really trying to focus on this challenge. Oftentimes you realize that it takes kind of a collective whole to address the provider data problem. So it's great to see that you all are committing resources and committing to solving the problem. So our third polling question: do you believe that your current process is enough to make marked improvements in your accuracy of your directory data? Great, thanks for those responses as well. It's interesting to see, just based on the conversations that I've had with a lot of organizations, the 0% of yes, our process is fine. And I definitely say that's the feedback that we get from the market, right? I think there's a lot of improvements as an industry we can do to improve provider data accuracy, whether it's just for directories or just the global whole of provider data. So thanks for those responses. Great. So we wanted to take a few minutes to go through some frequently asked questions that we hear, right? So again, I've had conversations with hundreds of organizations regarding provider directory concerns. So some of the feedback, and these questions are actually coming directly from webinars, but they're definitely questions that we also hear when talking to organizations. So one of the questions we hear is, and I'm going to paraphrase this one a little bit, but when working with provider directory information, how are you able to ensure that you're getting the right content, right? How are you able to ensure that you're getting the demographics to the practice location as opposed to billing information, and how are some organizations overcoming this? I think it's what data you're sourcing makes a big difference. So you hear of organizations using provider portals that are primarily focused on payment transactions and using that as a source for directory information. And I think by the nature and the users and kind of the lens that those users are looking at the world through, you tend to get more billing information. So focusing on, where are you getting your information from? Is it the right source? Is it the right audience to give you the information, the type of information that you want regarding practice location information? The other component in what we see the biggest success with the organizations that we work with today, and a lot of the ones that we perhaps don't work with but would like to, is communication, right? So making sure that you're out there educating providers and letting them know that this is an important issue for you as an organization, and providing value to the providers as far as having accurate information in the directory for members to find them. So without educating providers and asking them more questions, we're not going to get the results we want. So we really need to be able to get out there as an industry, as individual organizations, and share the message that this information is important. This is why it's important to both the organizations as well as the providers, and then also making sure that they're providing that information in a timely fashion, and how to get that information over to you as an organization. Another question we hear is about penalties, right? So tying specifically to attestations and the timeliness of that. As any of the CAQH users of our ProView solution or our Direct Assure solution probably know, we do go through the regular attestation of 120 days. That's really more around data accuracy or data timeliness for NCQA and Medicare requirements for credentialing. From what we have seen and from the organizations I've had the opportunity to speak with, there aren't specific penalties around attestation when it comes to data accuracy. So CMS requires outreach, and so we haven't seen any requirements around responses to outreach outside of, I believe, California is the only state that has a specific outreach response requirement. So it is more of the checking the box that you are communicating out to providers that that information needs to be updated if it is changed. What I've seen in several of the CMS audits and the conversations that I've had is really it's about data accuracy. So less so the attestation of the data, but if the information is correct. So if a provider attests to incorrect data, an audit isn't going to really concern themselves too much as to whether or not it's attested data. Sure, that could be an argument back to the auditing body, but at the end of the day, the goal is to have accurate data. So how do we do that? And attestation is a way to do that by having providers go into the system, but there's no penalty specifically around not having attested data. So network adequacy, right? So if anyone's seen any of the CMS audits that were released in 2018 and prior, a lot of what the issues were around provider directory accuracy was providers not practicing at a location. So as an exercise of kind of addressing inaccuracies, the practice of going and updating or eliminating bad locations, inaccurate locations from your directories, in turn could have an impact on reporting of adequacy. And I say reporting of adequacy because reporting an inaccurate location does not truly meet an adequacy requirement. And if you look at it from the intention, I believe, of CMS, not that I can speak for their intentions, but and the plans for the goals for the members themselves is I need to be able to find that the provider is actually at that location, right? So reporting an inaccurate location could, in effect, be a problem both for the membership and the auditors at the end of the day. So when we're talking about being able to solve for that, organizations are using various analytic arms. We also, not that this is a solutions meeting for us to present any of our products necessarily, but as part of our Direct Assure solution, we are actually capturing location data from all of the organizations. and we're able to share the location, not who has the provider with that location, but share additional location information that providers are reporting through ProView. So there are various ways to kind of backfill, if you will, those inaccurate locations with new location data and make sure that you're also providing an adequate network for your members. Another question is around hospital-based providers, right? So one of those challenges, much like, oftentimes the delegated provider issue, is how are we making sure that we're able to collect accurate or manage accurate updates from hospital-based providers. So the various mechanisms there. I think that the delegated provider population, there's a lot of opportunity to improve that process through standardization, through industry alignment, alignment and expectations. So that's one of the processes that can be looked at, right? So again, not a pitch for CAQH solutions, but we have been able to make some changes to the CAQH ProView platform to now be able to accept group rosters with the intention of aligning the industry, much like we did for ProView in collecting the individual provider data, using a group roster to be able to redistribute group rosters through the industry and kind of streamline that process, bringing back to that one-to-many concept that we've started with the ProView solution. So next one, probably my favorite, because I have a very broad answer for this, but how are healthcare organizations measuring data accuracy? Oftentimes it's all over the place, right? So you hear organizations that are applying a lot of manual resources to measure their own accuracy internally. A lot of times it's hiring phone vendors, it's doing data bumps against other sources of information. A lot of provider abrasion included in that too, especially when you're talking about outreach and calling providers' offices to validate what they just told you. We hear of organizations that are waiting for the audit. So there's groups out there that definitely don't have the resources or are not prioritizing the problem enough to do their own internal accuracy audits. And so they're waiting for the auditing bodies to come back and do their own audit and then using that as that benchmark to get started. At the end of the day, it's a lot of resources, so it's important for the industry to find an effective way to really address the inaccuracy problem and be able to do some real-time evaluation on accuracy over time. The next and last frequently asked question we have, and then we'll go ahead and open this up to the group to share any questions you all might have, and I'll do my best to answer them. How are we as CAQH measuring data quality improvement? What is the baseline? Is it based on what's audited by CMS? What fields are we seeing the most improvement? It's a lot of questions here. As far as a baseline goes, we're really looking to the organizations to identify what their quote unquote accuracy rate is. Oftentimes that is coming from a CMS audit. So we're looking at the CMS audit and saying, okay, this organization is at a 45% accuracy rate. Then how do we make those improvements? If you, again, have seen any of the CMS audits, you'll see that most of the deficiencies have been around providers not practicing at locations. So from a solution perspective, in our Director Share solution, we've been able to kind of try to dial in on just that inaccurate location data. And by removing inaccurate locations, we are in turn then also removing a lot of other subsequent inaccurate information. And that's helping improve provider directories as a whole. When you're looking at specific individual fields, phone numbers are a big number, are, I think, the second most common error rate. So we're also looking at and kind of, if you will, forcing providers to respond to phone numbers and ensuring that it is actually a phone number for making appointments. But primarily the biggest focus and the biggest improvement we see is around cleaning up those bad addresses from the directory. And we do our own internal audits and do some outbound phone calling as well, just to help support that and make sure that our methodology is actually having a real impact on the overall accuracy that we're bringing to the industry. So we're going to go ahead and open this up to any questions you all want to send through the questions box, and we'll kind of sort through these and provide some responses. So don't be shy, folks. Some opportunity to provide some questions if you have any questions that you want to ask about any of CAQH's products or anything that we've seen from in our conversations, again, with organizations such as yourselves. One that has come up in the past is regarding CMS or other state regulators or even any of the other governing bodies around provider data, endorsing any specific product or solution, much like NCQA would assign an endorsement for specific CVOs, if you will. So as of today, I'm not aware of CMS providing any endorsements. I do know there's some work to drive some work through NPES, the MPI database, and they're doing some work around that, although that's another data source for providers to submit information through, I suppose. NCQA has endorsed at least CAQH's Direct Assure product when it comes to complying with the NCQA directory requirements. But as far as the regulators go, I have not seen any that are specific to a product or a solution. So there's a question regarding CMS indicating another round of audits coming through. So with the CMS audits, I haven't heard when they plan on publishing those. My understanding was there weren't any published audits for 2019. At least I haven't seen any. I don't know. I have heard that there's intentions to start the audit process again in 2020. Whether those will result in penalties or additional actions will be interesting to see, but we haven't heard any specific timing around when those audits or when those responses will be available for the population to review. We'll give another minute for questions, and then if not, we'll let you all return to your busy days and finish your lunches.
Okay.
All right, thanks. So one more question came through, and then we'll go ahead and send everyone back to what really matters. There was a question regarding a provider in CAQH whose data was inaccurate, right? So somebody had contacted, the provider had incorrect locations, and was actually recently attested data. I think some of this ties back to education, right? So our Direct Assure solution is designed to push data in front of providers for them to review that information. But again, if providers don't know the value or recognize the value or how that information is potentially being used by healthcare organizations, they won't necessarily engage in the way that we need them to engage as an industry. So I think it's important to remind providers, regardless of what your data source is, that you are using this information to remain compliant and to put that information in front of members and potential patients for the providers. So again, regardless of where you're getting your information from, you need to let providers know how that information is being used and the value in that information being correct. So I want to thank everybody for joining us today. Hopefully you were able to take some information away from some of the experiences we have and the conversations we've been able to participate in. I think at the end of the day, it's going to take a village. So for us to improve provider data, we're going to have to collectively get together and have a combined message out to the provider population and to the regulators as well, that there's an important path where we need to align on how this information is going to be shared and distributed throughout the industry. So thank you again. If there's any additional questions, my contact information is available here. Feel free to go ahead and shoot me an email with any questions maybe that we didn't get to or that you might have following the call. And then, of course, if you have any interest in submitting over, we are happy to do our own audit. So we can definitely do some evaluations for any organizations that are interested on looking at practice locations. So we'll go ahead and submit one last polling question. So if you are interested, just go ahead and let us know through this polling question. Again, it's a relatively light lift of you sending us a file of locations, and we can do a comparison to what we have through our solution suite. Well, thanks again, everyone, and we hope you have a great rest of your week, and we'll speak to you at the next webinar.